So the KW4 OHT is one of the fastest growing cities in the province as well as in the country. And that when you look at the growth, what's interesting is that this growth is tied to our newcomers. So really, we needed to better understand some of the challenges and opportunities that our newcomers were facing. So in the summer of 2022, we created a process where we could journey map our newcomer stories to better understand what was working, how they interacted with the healthcare system, and the opportunities for improvement. What we learned from our interviews was that many of our newcomers were keen to self navigate and that often weren't able to find the information themselves in order to make decisions, that they were dependent on our systems that were very people focused and going into certain places, etc. We also learned that many of them had challenges accessing healthcare services, in particular, finding access to primary care services. It was equally, if not as important as finding a job, having access to shelter, access to social supports. And all of them talked about mental health challenges, the difficulty in accessing the mental health services across our region. So our hypothesis was that if we could better understand the needs of our newcomers in the first 5 years, that we can maintain their health and possibly prevent the decline. Our recent data shows that the highest portion of our marginalized population, which includes Indigenous peoples, visible minorities, newcomers, live in 4 priority neighborhoods. These neighborhoods represent about 18.4% of our population in KW4, but they represent almost 35% of our ambulatory care visits to our hospitals. And so we're starting to see that these individuals, once they're in the hospital and are finished their care, can't necessarily have the resources or the supports to be able to go back into the community. So what we did was we brought together our providers who deliver care in these neighborhoods, but we also partnered with the University of Waterloo to better understand best practices and evidence-based care related to social prescribing and the importance of the social determinants of health. Once we were able to pull these groups together, we wanted to work with our community agencies and our community providers as well to start to build and develop some personas around the priority populations within these neighborhoods. So through a series of several workshops, we started to develop 3 pathways that help to, if you will, put a face to some of the challenges that were being faced in these communities. And we were able to develop 3 personas. The first one was related to a senior with a heart failure. And this is one of the largest ED visit causes in our region. Certainly a diabetes pathway related to our newcomers, because we know that chronic disease in our newcomers is growing at an alarming rate. And then a third one that really came from, I would say, our community partners and our community members was youth transitioning to adulthood and accessing mental health services in that transition spot. So these pathways focus on supporting community members within the community with the goal to improve overall wellness, but also reduce hospital admissions and readmissions. Some of the lessons learned, first of all, we know to achieve improved health and wellness, we need to take a population health approach. Second, a population health approach with focus on health equity helps us understand the issues faced by our communities and create more comprehensive care plans that impact our system indicators. If we continue to focus on system indicators without taking the time to understand the hyperlocal or population differences, we won't actually be able to improve the system and move the needle. So, for example, when we talk about translation services, having access to a preferred language is important, regardless of whether you're going to speak with your primary care provider or you're looking for a job. And yet, one of the common tension points that we see is that translation services is seen as a health function only, rather than something that, as a newcomer, would improve your health and wellness overall. And finally, with respect to evaluation, it takes time and requires providing support and education to our non-traditional partners. So for example, working with our settlement agencies, as well as our hospitals and our community agencies, including our grassroots agencies, is a very different approach than doing research or performance measurement and management within a hospital alone, for example. And so the level of understanding and knowledge can vastly vary. And then finally, this is a long journey. And the indicators that we use may need to expand to consider non-traditional healthcare indicators. So, for example, by using the quintuple aim to allow us to better understand our impact, we can start to influence the system and improve health equity for all in our communities. Thank you.